Hi, this is Dr. Yoon Han Kim. I'm an integrative and functional medicine physician, an expert in LDN. Today's topic is about LDN and autism and hopeful path for symptom management. That's the title. I think that first of all, I think that there's still a lot we don't know. As a matter of fact, I think there's probably more we don't know the root causes of autism than what do we know. And what we do often in this case, as with fibromyalgia, as with chronic fatigue syndrome, we just create a name and it kind of serves as a bucket that people with conditions with these symptoms just conveniently go into this bucket. And then we pretend we got the answers. And I'm not sure we do. And I'm an expert in LDN. I'm a believer of LDN. I've seen LDN create a lot of miracles. But I'm cautious to say that LDN should and could be the full solution to autism. I just don't think that that is the case. Now, having said that, LDN is a fantastic tool for someone with autism. And the reason is the mechanism of what people believe. Some people think that that there's an excess opioids that contributes to symptoms like social withdrawal, decreased response to pain, and sensory sensitivities. And by blocking opioid receptor by LDN, the body can rebalance. And I remember there was a kid in my practice that slept all day, and that was one of her symptoms. And what happened is that with LDN, the person woke up, really woke up. Instead of having 1 or 2 hours, the person began to get portions of days back. And I explained to the parent that this had to do with overproduction of opioid. In this case, that opioid excess theory seems to be correct. Now, having said that, having treated other kids with autism, I would say that it's not a prominent mechanism. So the other part would say that perhaps there's a autoimmune inflammatory process in the in looking at the uh, like a neural degenerative pathway, or the damage has done and now it's staying there. So I know that the inflammation, this kind of inflammation, can be undone by microglia inhibition. And what LDN does is that it is, of course, an opioid um, inhibitor, but in addition, it's also a toll-like receptor 4 inhibitor, which inhibits microglia. Microglia pretty much is the pro-inflammatory agent. So by inhibiting microglia to become pro-inflammatory, in an effect, LDN creates anti-inflammatory environment within nervous system. And I see this a lot when we treat neuropathy or pain related to the nerves. And LDN also is excellent for any irritability condition for brain. Now, what does research say? Research actually says that there was a double-blind, placebo-controlled study, which is considered the gold standard, and children with autism who received naltrexone showed significant improvements in hyperactivity and irritability. And what they then did is in 2006 they did a review of cases where children with autism were treated with naltrexone, and 70% actually showed symptom improvement. And this is consistent with my overall LDN improvement rate is about 70%. And then there's 30% who don't respond. So, and then 2015, they did a systemic review that looked at 10 different studies and concluded that there's a moderate evidence that opioid blocking mechanism like naltrexone could help with reduce the core autism symptoms. Now, what I like to say is that I think in our Western culture mindset, we like one condition to be cured by one method. And I think that looking at other brain health related conditions, I'm finding that's probably not how things work. I'll give you an example. I'm used to helping patients with memory issues to regain their memory. LDN is not enough, and other things I do is not enough. We have to make a change in their diet. We have to make change in cognitive exercising, because the neural pathways also respond to training. So I do believe that more holistic methods should be employed to treat autism, but I'm also cautiously optimistic that research shows that low dose naltrexone actually appears to have a place in calming down the brain, which I know, reducing neuroinflammation, which I know, and perhaps being useful for treating patients with autism. So that's what I like to say. Well, thank you so much. And if you like the video, please give me a like, share with someone that may benefit, and subscribe to the channel and hit the bell so that you'll be notified when I make more of these videos. Thank you.